Continuous positive airway pressure, better known as CPAP, is a form of therapy for spontaneously breathing patients suffering from respiratory failure or lung disease. CPAP has been useful for type 1 respiratory failure, especially in treating patients with acute cardiogenic pulmonary edema, congestive heart failure, pneumonia, and sleep apnea. The positive pressure from CPAP helps by pushing the fluid away from the lungs and into the circulation. This will prevent the fluid from entering back into the lungs. CPAP also helps to keep the patient's airway open and prevents the upper airway from collapsing. In preparation for setting up the therapy, first, place the breathing circuit onto the patient outlet port of the flow generator. Then, insert the bacterial viral filter onto the air entrainment port. It is recommended to use an oxygen analyzer to alert of any loss of oxygen wall pressure or other system faults. Add an additional bacterial viral filter in the circuit setup for added protection if required. If the flow generator requires the use of an external safety PEEP valve, make sure the valve is securely positioned at the end of the breathing circuit. The safety PEEP valve helps in the event where the PEEP valve that is attached to the face mask becomes occluded. Thus, any excess circuit pressure above the prescribed PEEP pressure will be relieved. External monitoring should be used to ensure that the flow generator setting is suitable for the patient. Devices such as a manometer or an inline pressure gauge will show a constant pressure approximately the same as the PEEP valve specification. If the delivered flow is too low, the pressure exhibited will indicate a significant drop when the patient inhales. This inadequate flow can be corrected by increasing the flow from the flow generator. Follow the manufacturer's guidelines in operating the flow generator. Listen for leaks before attaching the CPAP mask to the patient. Once testing is completed and the desired flow rate has been set, place the CPAP mask onto the patient's face. Using the head strap to hold the mask in place, fasten it by placing the strap around the patient's head. Make sure that the patient gets a good seal with the CPAP mask. If the patient requires a smaller mask, replace the large size mask with a medium size mask instead. Check for any leaks coming out of the mask and continue to monitor the patient's condition and treatment. Respiratory patients can benefit from CPAP as it avoids the need for intubation and the associated risks. Flexicare offers a complete CPAP solution, including 7 different fixed PEEP valves that range from 2.5 centimeters of water to 20 centimeters of water, which are color-coded. Along with 2 different sizes of CPAP masks and head strap, our offerings can include either passive or active humidification systems when placed with a flow generator in the hospital. For more information, visit flexicare.com.